In this presentation, we will cover all aspects of your knee replacement surgery journey. First, we'll walk through an overview of the surgery itself, explaining the steps involved and the goals of the procedure. Next, you'll learn what to expect during your recovery, including timelines for pain relief and mobility improvement. We'll also address some possible post-operative complications, like infections or blood clots, so you can recognize symptoms early and seek help if needed. Finally, we'll focus on post-op care and rehabilitation, ensuring that you have the best information to help you recover fully and regain mobility. The knee is the most common joint affected by osteoarthritis. It's a large, weight-bearing joint, has complex motion patterns, and is a common site of injury. This is an example of what an arthritic knee looks like on an X-ray, in contrast to a normal, healthy knee. The healthy knee is on the right side, where you can see good preservation and space in the joint between the femur and the tibia bone, versus the arthritic bone-on-bone X-ray on the left side that reflects end-stage advanced osteoarthritis. If you look at the knee joint, it is made up of the femur bone, the tibia bone, the kneecap, or patella, and it contains synovial fluid, which acts as a natural lubricant within the knee. The femur and the tibia are both covered with articular cartilage. In a healthy knee, that cartilage is smooth, with no fissuring, and with smooth bone. The synovial fluid aids in the lubrication of the knee, allowing full range of motion without pain. When moderate osteoarthritis develops in the knee, you can see degradation of the cartilage and damage to it on both the femur and the tibia. The lubricant within the knee also becomes less, resulting in joint pain that becomes more severe with movement and rest. When we do a knee replacement, we approach the knee from the front, moving the kneecap to the side to expose the bone surfaces. We prepare the bone surfaces, remove the damaged cartilage, and replace it with metallic caps and plastic in between to act as the new cartilage in lieu of the bone-on-bone arthritic knee. This construct allows for friction-free range of motion and tries to mimic as best as possible your natural knee. The knee replacement implants are designed to mimic the normal kinematics and motion of your knee, trying to make it as natural as possible. Proper management of medications before surgery is crucial for a safe procedure. Patients should stop taking all supplements and vitamins at least 7 days prior to surgery to avoid any potential interactions or complications. Similarly, it is essential to refrain from using NSAIDs such as ibuprofen, Aleve, naproxen, or meloxicam for 7 days before surgery. For all other medications, continue as directed unless otherwise advised by the pre-admission nursing team. This approach helps in minimizing risks and ensuring optimal surgical outcomes. The day before surgery, it's essential to follow certain guidelines to ensure a safe and successful procedure. Avoid shaving your legs the day before or on the day of surgery, as this can cause skin irritation or small cuts that could lead to infection. Make sure to shower with Hibiclin soap as instructed to help reduce the risk of infection during the surgery. Also, do not eat or drink anything, including water, chewing gum, or candy, after midnight. On the day of your surgery, it is essential to ensure that all pre-surgical confirmations are correctly carried out. Your surgeon will meet with you to verbally confirm which extremity is to be operated on. This step is crucial in avoiding any confusion or errors. Additionally, the surgeon will mark the hip that is to be operated on with a visible mark. This marking process is an important safety measure to ensure that the surgery is performed on the correct side. These steps are in place to maximize the accuracy and safety of your procedure. Before your hip replacement surgery, you will be administered anesthesia to ensure you remain comfortable and pain-free throughout the procedure. Two types of anesthesia are commonly used. Spinal anesthesia numbs the lower part of your body while keeping you awake, allowing you to be alert but pain-free. General anesthesia, on the other hand, will put you in a sleep-like state, unconscious for the duration of the surgery. The choice between these methods will depend on your medical history, your preferences, and your surgeon's recommendations. Physical therapy is a crucial part of your recovery process after hip replacement surgery. On the day of your surgery, a nurse will assist you in getting out of bed to prepare for your initial therapy session. This step helps you regain mobility and begin the journey to recovery. Your physical therapists will then guide you through exercises and movements designed to strengthen your muscles and improve your range of motion, ensuring you are prepared to go home safely. The focus is on helping you achieve independence in daily activities as quickly and safely as possible. Unfortunately, even the most minor of surgical operations carries some risk of complications occurring. Knee replacement surgery is very successful, and complications are relatively uncommon, considering the complexity of the procedure. Most complications are temporary setbacks. You have about a 98% chance that you will go through the operation without some significant complication, which causes an ongoing problem. The most common complication is blood clots in the legs. The most serious complication is infection. The most important long-term complication is loosening or wear. To prevent blood clots, blood thinners will be given to you first day after surgery. Additionally, leg exercises are encouraged to prevent blood clots. Unfortunately, blood clots can occur despite all these precautions. As long as the clots remain in the legs, they are a relatively minor problem. Occasionally, they dislodge and travel through the heart to the lungs, causing a pulmonary embolism. When it comes to infection, the risk of deep infection in a first-time knee replacement is approximately about 1 percentage point. Superficial redness or wound issues are more common and usually resolve quickly with antibiotics. You'll receive antibiotics before and after the surgery to help prevent infections, and you'll continue taking them for a week after surgery. Patients who have had joint replacements must take antibiotics by mouth before any dental work for 2 years after their hip replacement and must have all infections vigorously treated. Bleeding is another potential issue. Bleeding is minimized during surgery with anesthesia and IV medications. Sometimes bleeding can cause a hematoma, which is a collection of blood under the skin, but this often resolves on its own within 4 to 6 weeks. Loosening of the prosthesis from the bone is the most important long-term problem or complication that can occur. You can see in the X-ray on the left where there is loosening of the implant, which was subsequently revised, with the X-ray on the right showing the corrected result. How long the prosthesis lasts depends on a number of factors, including the quality of the surgery, the quality of your bones, how active you are, your weight, and the design and materials of the implant. There have been significant improvements over the years in terms of implant design. We have many sizes available for each of the components to best match every bone anatomy and shape. It is crucial that you participate in physical therapy after your knee replacement. This will help you achieve the flexibility, motion, and strength needed after surgery. Your physical therapist will work with you on different exercises to achieve this motion and flexibility and will assist throughout your post-operative care. Sometimes it is difficult to regain bending motion that has been lost for many years. If the knee could only bend 90 degrees prior to the knee replacement, it is unlikely to bend much more after the operation. For unexplained reasons, some patients form excessive scar tissue in the knee after their replacement, which can result in diminished bending of the knee. If stiffness persists despite physical therapy, sometimes a manipulation under anesthesia may be required. In virtually all cases, knee replacement will significantly improve your pain and mobility. The degree of pain relief and mobility depends on your pre-surgery knee condition and your progress with physical therapy afterward. Injury to the arteries or nerves of the leg is an exceedingly rare but possible complication from knee replacement surgery. The major arteries of the leg lie close to the back of the knee joint. If the nerves of the leg are injured, they usually recover, but it may take up to 6 months or longer. Most patients experience some numbness around the incision, which generally decreases with time as well, though may not completely resolve. Some patients may experience clicking when walking with their knee replacement. It is not unusual for people to hear or feel their knee replacement after surgery. Anesthesia-related complications are also rare, but your anesthesiologist will explain the risks before the surgery. For a smooth and optimal recovery after knee replacement surgery, it's important to adopt daily habits that promote healing. Staying active with light exercises helps maintain mobility and prevent complications. A balanced diet rich in essential nutrients supports your body's healing process, while staying hydrated keeps you well-nourished and reduces the risk of complications. Additionally, adhering to your medication schedule and attending follow-up appointments ensures that your recovery is closely monitored and any issues are promptly addressed. After knee replacement surgery, it is important to follow specific guidelines to ensure a safe recovery. Initially, you will use a walker for protection, typically for the first 1 to 2 weeks, depending on your progress. Full weight bearing on the operated leg is usually allowed immediately, but always follow your healthcare provider's instructions. It is crucial to avoid high-impact activities like sports, using exercise equipment, or lifting weights until you receive clearance from your surgeon. These precautions help in protecting the surgical site and promoting a smooth recovery. Ice reduces swelling and inflammation, helps manage pain by numbing the surgical area, and promotes healing by improving circulation. To use it effectively, use an ice pack or cold compress. Place a thin cloth or towel between the ice and your skin to prevent frostbite. and apply ice for 15 to 20 minutes at a time, several times a day, especially after physical activity. You want to ice immediately after surgery and during the first few weeks of recovery, after physical therapy sessions or any increase in activity, and whenever you experience increased pain or swelling. Avoid applying ice directly to the skin. Do not use ice for more than 20 minutes to prevent skin damage. After your knee replacement surgery, you will have a waterproof dressing applied to your operative knee. This dressing is designed to protect your incision and allow you to shower without worrying about water exposure. It is important to keep this dressing on for the full 2-week period to promote proper healing and prevent infection. At your first post-operative appointment, we will carefully change the dressing for you. This appointment is also an opportunity to check the incision site and ensure everything is healing as expected. Maintaining the integrity of your dressing is crucial for a smooth recovery. If you notice any issues with the dressing or have concerns, don't hesitate to contact our office. 1 week after your knee replacement surgery, you are allowed to shower, but it is essential to keep the watertight dressing in place to protect your incision from water exposure. However, it's crucial to avoid submerging your surgical wounds in water for at least 4 weeks after surgery. This includes baths, swimming pools, and hot tubs. Submerging your wound could increase the risk of infection and delay healing. Managing pain effectively at home after knee replacement surgery is crucial for a smooth recovery. It's advisable to take pain medication with food to help reduce nausea. Taking your medication before bedtime can also help you sleep better. Remember that pain medications usually take 30 to 45 minutes to start working, so it's important not to wait until the pain is severe to take them. Understand that these medications may not completely eliminate all pain, and it is okay to experience some discomfort as part of the healing process. Weaning off narcotic pain medications is a crucial part of your recovery after surgery. Prolonged use of narcotics carries several risks, including dependence and other side effects. Therefore, most narcotic pain medications will not be prescribed after 6 weeks post-surgery. It is important to create a plan to gradually reduce the use of narcotics. Work closely with your healthcare provider to manage this process, ensuring you transition smoothly and maintain adequate pain control during your recovery period. Nausea and vomiting are common experiences following surgery due to anesthesia and pain medications. To manage these symptoms, take small sips of clear fluids and eat light meals, avoiding heavy or greasy foods. Resting in an upright position can also help alleviate nausea. To further manage nausea, post-operative medications will be prescribed. These medications are designed to reduce the likelihood of nausea and vomiting, ensuring a more comfortable recovery process. Constipation is a common side effect of pain medications often used after surgery. To help manage this, a stool softener will be prescribed to ease bowel movements. Additionally, consider using over-the-counter laxatives, eating a high-fiber diet, and drinking fruit juice to promote regularity. Taking these steps will help minimize discomfort and promote a smoother recovery process. After surgery, most home medications can typically be resumed unless specifically instructed otherwise by your healthcare provider. This includes any vitamins and supplements that were part of your routine prior to surgery. It's important to follow the guidance provided to ensure a safe and smooth recovery. The primary goals of physical therapy after surgery are to restore mobility, enhance strength, reduce pain and swelling, prevent complications, and promote independence. Therapy generally begins within a week post-surgery, allowing initial healing and enabling gradual strength and mobility building. Following these objectives ensures a safe and efficient recovery, enabling you to return to daily activities promptly. Returning to driving after surgery requires careful consideration of your safety and healing status. While on narcotic pain medications, driving is strongly discouraged due to their impact on your alertness and reaction time. Additionally, if you experience pain in your knee while driving, it may be a sign that further recovery is needed. Typically, patients can expect to return to driving within 2 to 4 weeks, but always consult with your healthcare provider before resuming driving. After your knee replacement surgery, it is crucial to monitor your recovery closely. There are specific signs that may indicate complications or concerns that require immediate medical attention. For example, a fever above 101.5 Fahrenheit could suggest an infection that needs urgent care. Similarly, if you experience excess pain or swelling in your calf, this may be a sign of a blood clot. Additionally, any significant drainage from the surgical incision or redness around the incision site could indicate an infection. It is essential to call our office right away if you notice any of these symptoms, as early intervention can prevent more severe complications. Your health and safety are our top priorities, so don't hesitate to reach out if you have any concerns during your recovery. It's important to attend your scheduled post-operative appointments to ensure a smooth and healthy recovery. Your first appointment will be 2 weeks after surgery to assess your early healing and check your incision. This visit allows us to address any immediate concerns and guide you through the next phase of your recovery. Your second appointment, typically at 6 weeks post-surgery, will evaluate your progress in greater detail. We'll discuss how well you are adjusting to your new knee, assess your range of motion, and answer any questions you may have about your recovery or physical therapy regimen. Please mark your calendar and feel free to call our office if you need to adjust your appointment times. In conclusion, major surgery is not without risk. There are risks in everything we do in life. Our medical staff will do everything we can to minimize the risks you undertake. The worse your preoperative symptoms are, the more reasonable it is to take the risk inherent in having a knee replacement. Remember, the main goal of your knee replacement is to improve your quality of life. We look forward to helping you through your upcoming knee replacement surgery, and we hope this presentation has given you more insight into your surgery.